Artificial intelligence doctor. User question. How does the implantation of single-chamber leadless pacemakers affect the progression of heart failure in elderly patients? GPT-01 answer. Thought for 7 seconds. The implantation of single-chamber leadless pacemakers in elderly patients has emerged as a significant advancement in cardiac pacing technology. These devices are implanted directly into the right ventricle of the heart without the need for transvenous leads or a subcutaneous pocket, reducing the risk of complications associated with traditional pacemakers, such as infections and lead-related issues. Impact on heart failure progression. Reduction in procedural complications. Infection risk. Leadless pacemakers eliminate the need for leads and surgical pockets, substantially reducing the risk of device-related infections, which can exacerbate heart failure symptoms. Recovery time. The minimally invasive nature of the procedure often results in shorter hospital stays and quicker recovery times, which is particularly beneficial for elderly patients who may have comorbid conditions. Pacing-induced cardiomyopathy concerns. Ventricular desynchrony. Single-chamber pacemakers stimulate only one chamber, usually the right ventricle, which can lead to ventricular desynchrony. This desynchrony has been associated with pacing-induced cardiomyopathy, potentially worsening heart failure over time. High pacing burden. Patients requiring a high percentage of ventricular pacing are at increased risk of developing or exacerbating heart failure due to the unnatural pacing rhythm imposed on the heart. Clinical studies and evidence. Limited long-term data. As of my knowledge cutoff in October 2023, long-term data on the impact of leadless pacemakers on heart failure progression are limited. Most studies have focused on short to mid-term outcomes, primarily highlighting safety and efficacy. Comparative studies. Some studies suggest that while leadless pacemakers are effective in reducing procedural complications, they do not significantly differ from traditional single-chamber pacemakers in terms of influencing heart failure progression. Patient selection and management. Appropriate candidates. Elderly patients with atrial fibrillation and a slow ventricular response, or those with contraindications to leads, may benefit the most from leadless pacemakers. Monitoring and follow-up. Regular monitoring is essential to assess ventricular function and adjust treatment plans accordingly to mitigate potential negative effects on heart failure. Conclusion. While single-chamber leadless pacemakers offer several advantages in reducing procedural risks and improving the quality of life for elderly patients, their impact on the progression of heart failure is nuanced. The potential for pacing-induced ventricular desynchrony means that these devices could contribute to the worsening of heart failure in some patients, particularly those requiring a high degree of ventricular pacing. Recommendations. Individualized treatment. Careful patient selection is crucial. Assessing the patient's overall cardiac function and pacing needs can help determine if a leadless pacemaker is appropriate. Alternative therapies. For patients at high risk of heart failure progression, alternative pacing strategies like biventricular pacing, cardiac resynchronization therapy, may be more beneficial. Ongoing research. Further long-term studies are needed to fully understand the impact of leadless pacemakers on heart failure progression in elderly patients.